As a physician and the leader of a large health system, there's something I want to share with you. In the United States, we are really good at sickness care. In fact, we may be the best in the world. Sickness care is the care that you get when you come to the hospital, come to the emergency department. Sickness care is often about doing things, doing tests, and doing procedures. But I want to tell you something else. We're not getting the care that we need. I know this as a physician, as a healthcare executive, and as a daughter. In 2005, my father was diagnosed with a rapidly progressive dementia. He died in 2009, and in between, we struggled. As soon as I heard the diagnosis, I knew that he would continue to decline and soon become unrecognizable as the husband and father that we knew. But I thought, we've got this. I'm a doctor. My middle sister is a nurse and an Episcopal priest. My youngest sister is a social worker, and my mother was the world's best executive assistant. We were the perfect team. But it soon became clear that being the perfect team simply wasn't enough. We were challenged. We went from crisis to crisis. And the care was there when the crisis happened, but it was what occurred in between that was so difficult. He had multiple hospitalizations, multiple visits to the emergency department. And in one very poignant moment when we were in a psychiatric crisis center where he was absolutely convinced that his doctor was Dr. Sanjay Gupta from CNN, I thought, this just isn't right. He shouldn't be here. He should be at home. The resources that we thought were available to care for him either weren't accessible, weren't affordable, or simply didn't exist. Now, I know that many of you have had a similar experience, caring for a loved one with a complicated illness. And certainly if it's dementia, the worries about safety and wandering are all part of that concern. And I don't have to tell you that coordinating appointments, managing medication schedules, arranging transportation, getting information from one doctor to another doctor, it easily becomes a full-time job. And I also don't have to tell you that doing that job may mean the difference between your loved ones staying at home or going back to the hospital. We need a different system of care. We need a system that provides care between those moments of crisis, a system that prevents those moments of crisis. So here's something else that's really important to know. 5% of the population accounts for 50% of what we spend on health care. Think about that. Half of what we spend in health care goes to 5% of the population. Now, some of those people have a devastating illness, but most of those people have chronic disease, often multiple chronic diseases. It turns out that 45% of Americans have a chronic disease. Diseases like diabetes, hypertension, heart failure, chronic lung disease, depression. 81% of our hospital beds are filled with people who have complications from chronic disease. people with chronic disease, particularly people with multiple chronic diseases, are most at risk when it comes to care that's not well coordinated. And as you know, there's a human cost. There's a human cost, but there's also a financial cost. We spend over $3 trillion on health care in the United States. And it's going up. The costs are rising. People are paying more out of pocket. State government, federal government are stretched. Private employers are concerned about rising cost. We have to do something different. Part of our challenge is that the current payment system rewards sickness care. It's fee for service. People get paid for doing things, for the volume of care rather than the value of care. So if we're going to help achieve better health and do it at a lower cost, we need to make a fundamental change in how we deliver care. We need a system of care that supports people who have chronic disease, that doesn't let people bounce from crisis to crisis, but is a system that's proactive, meets people where they are, and gives them the opportunity to lead a quality of life that's meaningful to them, that keeps them at home, keeps them in the community, and provides care that's affordable. So there are a lot of creative ways that people are thinking about solving this issue. And at Christiana Care Health System in Wilmington, Delaware, we've developed an approach to caring for people with chronic disease. We call it Christiana Care, Carelink. And it's why I'm so optimistic about the future of healthcare. So let me tell you a story. Let me tell you about Denise. Denise is 68 years old, and she has diabetes. She recently became the guardian of 4 grandchildren. She's stressed, and her finances are stretched. She stops going to her primary care physician. She stops seeing her therapist. She starts cutting corners with her medication. So not surprisingly, soon Denise doesn't feel very well, most of the time. So she does what most people do when they don't feel well. She goes to the emergency department. In fact, she goes 7 times in 3 months. And on several of those occasions, she's admitted to the hospital. So what does Carelink do that's different? So Carelink starts with a unique, innovative data platform. So think of it this way. All of Denise's healthcare information, regardless of where she gets care, regardless of which hospital, which physician's office, which lab testing center, all of that information goes into a data bucket. And it's Denise's own data bucket. And better yet, it goes there in real time. And then Carelink uses artificial intelligence and machine learning to help us understand what is it that's putting Denise at risk. And then it uses that learning to create a tool that relies on predictive analytics to help determine exactly what Denise's risk is in real time. And most importantly, it then informs the Carelink team. It alerts the Carelink team, a team of wonderful, compassionate, caring professionals, nurses, physicians, social workers, therapists, nutritionists. It gives the Carelink team the opportunity to be proactive, to reach out, to make a difference for Denise and others like Denise before the crisis occurs. So this is what the Carelink team did for Denise. The nurse called her and learned about the 4 grandchildren. and understood the kind of stress that Denise was under. So the Carelink nurse got the Carelink social worker involved. The Carelink social worker linked Denise and her family to community resources that would help support her in caring for her grandchildren. The Carelink nurse also engaged the Carelink pharmacist. The Carelink pharmacist reviewed her medications and was able to make some changes, trim the list, find more affordable medications, and then also enroll her in a financial assistance program. The Carelink nurse did something else. She connected Denise back to her primary care physician, who said, "I was wondering what happened to Denise. Haven't seen her for a while." And the nurse also connected Denise back to her therapist. A whole team, not only addressing Denise's medical needs, but also thinking holistically about her social needs and what it would take to help Denise stay healthy. But along the way, the social worker found something that nobody expected. Denise couldn't read, Denise couldn't write, and Denise couldn't understand numbers. So every time Denise had been given a piece of paper, "Your follow-up appointment is on such and such a date, call this number," it was useless for Denise. So the social worker did one more thing. The social worker got Denise to a literacy support group to help her learn some new skills. The Carelink team gave Denise the opportunity to access care that met all of her needs. They made sure that Denise went to her appointments. They made sure she took her medications. They connected her to community resources. They made sure that Denise didn't fall through the cracks. So what were the results? In the next 3 months, no emergency department visits, no hospitalizations, probably saving the system maybe $50,000 in avoided healthcare cost. But more importantly, Denise felt great. Denise was healthier, her diabetes was under control, and she had the resources that she needed to lead the quality of life that was important to her. She had energy to run after those grandchildren. In the first few months of Carelink, we know we're making a difference, not just for Denise, but for thousands of others. We're reducing readmissions to the hospital. We're reducing emergency department visits. Most importantly, we're improving health outcomes. People are getting back on their feet sooner after they've had surgery. People with chronic disease are able to stay at home more and lead the lives that are important to them in terms of quality. And in a few short months, we know that Carelink has saved millions of dollars. By creating a system that delivers the care that people need in the way that they need it, Carelink is making a difference. And I don't think we're finished yet. I think there's much more to come. I can envision a time when all of us have an app on that little computer that lives in our pocket or in our purse. And that app is our data bucket. And no matter where we are, whether we're in Delaware, in the United States, or anywhere in the world, wherever we get care, that all of that data comes into that app, into that data bucket. And better yet, all of that data is connected to a care team so that wherever we are, if we have an issue, we can reach out to that care team and get care. But more importantly, that care team can tell us that we're at risk for experiencing a crisis. And by reaching out to us, wherever we are, can prevent that crisis from happening, can change the trajectory of care. Simply put, it's about getting the right care in the right place at the right time. And it is the right thing to do. So I often think, I wonder what it would have been like for my family, particularly my mother, if Carelink had been around when my father was ill. I truly believe that if we had had access to Carelink, it would have made all the difference in the world. It would have meant that my father could have been at home more, and it would have meant that my mother could have been that effective caregiver she so desperately wanted to be, so important for her. So as a daughter, as a healthcare executive, and as a physician, I know that we can create a system of care that addresses the needs that we have, provides us with the health that we deserve, and do it in a way that's affordable. And that is sustainable value.